Hi everybody, and welcome back. This is Jenny, and this is the Private Practice for School Counselors channel, where we talk about things to help school counselors get into private practice. Today we're going to look at treatment planning, and I'm going to follow the thread that we've been talking about on the mock client Toby. We're going to go to the treatment plan that I started for Toby. Here you can see this is in Simple Practice, which is one of many options that you could use. This is just what I'm using right now. So we've got the diagnosis, which is going to have generalized anxiety disorder, major depressive disorder, single episode, moderate, and problems in relationship with spouse or partner. So that's the full diagnosis for Toby. We've got there's a lot of different templates in Simple Practice, so this is the one that I'm using. And he doesn't have a Medicaid number, but I have that there because for my Medicaid clients, I do need to make sure that I have their Medicaid number on all documents. And then I have information for their primary care physician and how to get a hold of that physician, medications. I like to get a release of information from clients and then contact the primary care providers, and if nothing else, just double check what are the medications and diagnoses that they have given. So then I have the diagnostic criteria or symptoms. And here this is more looking at, okay, for the diagnosis that I've given Toby, what are the symptoms that I can kind of tie back to the DSM to say this is why I've given this diagnosis. So here you can see I've described a little bit of who Toby is, that he is coming to treat symptoms of anxiety and depression, and I put some of the kind of just language that you would find in the DSM. Persistent restlessness, hypervigilance, difficulty relaxing, frequent and excessive worrying, and then, that these symptoms are occurring on most days and have been present actually for several years. And then I also put in that he's having difficulty with falling and staying asleep. And then with mood, he's experiencing sadness, hopelessness, negative thoughts about himself and others several times a week over the past 6 months, and he's reported a decline in emotional intimacy and communication with his spouse. So that touches on each of the parts of his diagnosis. Then the presenting problem, behavioral examples, is a pretty close cousin to what we were just looking at, but here I go into more detail about the specifics in Toby's life, how this is actually showing up for him in particular. So I'm moving away from just making sure that I'm touching on what criteria are in the DSM and moving towards just what's happening actually in Toby's life that kind of paints the picture of how these symptoms are showing up for him. So I say, Toby reported a lifelong struggle with anxiety, describing it as a constant presence for as long as he can remember. He noted that despite sleeping throughout the day, he rarely feels well rested and identifies himself as a light sleeper. Approximately 6 months ago, Toby began to notice a lack of closeness and connection with his spouse, which he had been deeply craving. This need for connection has since become more pronounced. Initially, Toby tried giving his spouse space, but later attempted to reestablish connection only to face repeated rejection. These experiences have left him feeling discouraged, hopeless, and despondent. Although he acknowledges experiencing symptoms of depression, he identified anxiety as his most pressing concern. Toby expressed a desire to achieve a greater sense of peace in his life. Currently, he reports severe anxiety symptoms, including persistent feelings of being on edge and an inability to relax occurring multiple times per day. He feels trapped in a distressing cycle of worry that significantly impairs his ability to function. Additionally, Toby continues to struggle with sleep, stating that despite efforts to sleep day and night, he wakes easily and never feels fully rested. And then I check off some of the strengths that I see for Toby, and I have kind of a list to help get me started, and then I do a narrative for his strengths. Toby independently sought treatment and acknowledged that this is his first experience with therapy. While he expressed some uncertainty about the therapeutic process, noting that it is not commonly utilized within his cultural background, he remains open to exploring this approach. He emphasized his strong motivation to find an effective means of fostering positive change in his life. And then we go to the barriers part of the treatment plan. So Toby's not employed. There's financial instability. He doesn't have a lot of hobbies or community support. And he's not close with his family. He's got poor sleeping habits. And then a history of substance use, lack of self-care practices. So I just check off kind of the things that I have on my list, and then I give the narrative again for barriers. A lot of times I'm trying to look at barriers in terms of not just those symptoms and the things that are maybe thoughts or feelings going on internally with the client, but looking at the things more externally in the client's environment that may also be factors that we want to just pay attention to. So Toby experiences significant difficulty relaxing, which contributes to ongoing sleep disturbances. He is currently unemployed and reports having limited energy for engaging in activities. He expressed a strong desire for closer interpersonal connections, particularly with his partner, Annie. However, Toby shared that he has no contact with his family of origin and has few meaningful relationships within his current household or social circle. So kind of trying to show, I did say a little bit of some things that are more internal, but I tried to also highlight, there's people that he wants to be close to, but they're not interested. Now we go to the risk assessment kind of portion of the treatment plan. Here you can see I have selected no significant risk reported or observed, and then I didn't check any of the things that risk would include, and there's no risk level. Of course, that could change with different clients, and you can put more information if the client did have a risk, and especially if it were, I would say, a medium and especially high risk, then you would want to do a safety plan with them and note that you have a safety plan on file, which would be a separate document. It's not right here in the treatment plan, but you would do it separately and then just make note in this treatment plan that you have done the safety plan. And then we've got the goals. So here with the goals, I put, this is kind of like what we really want at the end of the day. If we had that magic wand and we could make it be exactly how we want it to be, what would we see? So Toby expressed a desire to experience greater peace in his life and foster a closer, more communicative relationship with his partner, Annie. He hopes to alleviate the constant burden of anxiety that currently affects him. Additionally, he wishes to achieve more restful sleep and increase his motivation to engage in meaningful activities, such as building friendships, securing employment, and pursuing a more fulfilling life overall. So that's my narrative of what we're going for, and then under the objectives, I actually put the goals and then the objectives. So the goals are going to be taken from that narrative that I just read. And I just did a PESI training where I learned more about treatment planning and other parts and pieces to paperwork, progress notes, and that kind of thing. And it was super helpful, and I learned in there that the goals for the treatment plan are very broad, and they are just what we hope to see happen, as opposed to what either the clinician or the client would be doing. So you can see the first goal, reduce anxiety and hypervigilance. / increase relaxation and sense of peace. So under that goal, the bullet points that you see listed are the objectives, and those are the things that we're hoping for the client to do. So learn and practice relaxation techniques and explore and identify triggers that contribute to the excessive worry and hypervigilance, and then engage in corrective emotional experiences, which is something that we do in emotionally focused therapy, which is what I like to use. So that's the first goal. We have 3 goals for Toby. So the second one is to improve relationship with partner. Again, super broad. But under that, we have the objectives. Develop and refine communication skills. Participate in choreographed encounters. Again, something that I do with emotionally focused therapy. And then explore emotional needs within the relationship. And then the third goal is to decrease hopelessness and lack of motivation and increase self-efficacy and a sense of hope. So the objectives under that goal: identify and clarify personal values, develop a self-care plan, implement the self-care plan, and then validate and celebrate progress. So then under the interventions, the intervention that I'm going to be focused on is emotionally focused therapy. So this is where I'm saying what the clinician is going to do. The therapist will guide Toby in exploring his emotions using EFIT techniques such as the tango and emotional assembly. And then the therapist will create opportunities for Toby to engage in the choreographed encounters, helping him practice new ways of relating to himself and his spouse. And then throughout the process, the therapist will validate Toby's progress and encourage continued efforts towards achieving his therapeutic goals. There's lots of different interventions out there for all kinds of different modalities. So that's just one example. And then the progress is going to be looking at, how are we doing so far? And I put that in our initial session, Toby actively engaged in the treatment planning process. He openly discussed his needs and goals for therapy and demonstrated a commitment to the therapeutic process, despite it being a new experience for him. And then every 3 months, I update my treatment plans for my clients. So I would go back, and Simple Practice gives me a reminder, so I can just, when I get the reminder, when I get that for Toby, I'd come back in here and I'd make a new treatment plan, but I'd be able to look at what we did before, and I can add to that progress. And then over time, we start to get a nice kind of look at where we started for Toby and then how he's progressed over time. And then the treatment modality, frequency, duration. You can see here I have options listed for that. Then the discharge criteria. So Toby is going to be considered ready for discharge when he consistently and independently implements his self-care plan on a daily basis, experiences a significant reduction in anxiety and depression symptoms to a manageable level, and reports a satisfactory improvement in his connection and communication with others. And then I give a prognosis. So I think it's a mixed outlook. I'm not sure right now how it's going to go, so I said moderate. And then the medical necessity for continued treatment. So I have options, and I clicked the ones that feel right to me for Toby in particular. So you can kind of take a look at all that to get a sense of it. And then I say, okay, when did I talk to Toby and we had the verbal consent for this? When are we starting this? When are we going to update it? And then I click for when I want to have a reminder. I would save this, sign it, and then I can actually send it off to Toby, and Toby can officially sign it, and then that's when it's good to go. And then I do that process again every 3 months. When I do the update of the treatment plan, I ask folks to fill out those screeners, the GAT-7, the PHQ-9, and sometimes other things. So then I talk with them about, okay, here's what your scores on this were last time, here they are now, and we can talk about the new treatment plan, how progress is going. So it opens the door for that ongoing discussion about how are we doing. And that's basically, in a nutshell, what the treatment plan looks like. I hope that was helpful. Please let me know in the comments below if there's more that you're wanting out of this or any other topics that we're going to go through. And in the meantime, I just want to remind you all that you have options and opportunities. Until next time, I wish you well.